Hello, everyone. My name is Zayd Kidwai, and today I would like to take the opportunity to talk about the health crisis of Gaza. First and foremost, allow me to introduce myself. I'm a rising senior at Green Upstate High School in Greenville, South Carolina, and I'm a first-year participant in the Global Health Leaders Conference. I spend a lot of my time at school where I'm heavily involved. This upcoming fall, I'll be serving as student body president as a part of my school's student government club. I'll also be serving as president of my school's Beta Club chapter and just recently attended the national convention this past June in Savannah, Georgia. I'm also involved with my state's youth and government program, where I serve as a representative for my delegation and will actually be serving as a chamber presider at this November state conference. I'm also part of my school's Rho Kappa chapter and will be serving as treasurer. For this past month of June, I worked as a research intern with Converse University, studying red fluorescent proteins and how we could use the fluorescence to add functionalities. And for this current month, I've been working in my local hospital system, Prisma Health, as a student intern as a part of this Medics Academy program. In the far future, I hope to work against healthcare disparities and improve access to healthcare as a direct primary care physician in South Carolina. Today, I'd like to take the time to talk about the health crisis in Gaza. But first, let me define what a health crisis is. A health crisis is defined as an emergency situation on a healthcare system that affects the public in one or more geographic areas. Health crises generally have a negative effect, usually in terms of community health, mortality rate, and the economy. However, today I would like to talk about three of the most important issues in the health crisis of Gaza, which are mental health, water and sanitation, and access to healthcare. So first, mental health. Ongoing political and socioeconomic problems in Gaza has triggered a tsunami of various mental health issues within the past decade. A source from the National Institute of Health reported that the region's population, specifically the children and adolescents, has a high rate of mental health disorders, which can range from PTSD to depression. In 2022, Save the Children conducted a study with 500 children and 160 parents and found that 80% of Gazan children displayed some symptoms of emotional distress. 60% of Gazan children engaged in some form of self-harm, and around 50% of all participants reported experiencing suicidal thoughts. I would also like to talk about water access. The lack of access of consumable and water has long been an issue in Gaza, with less than 4% of their water being drinkable. Before the events of October 2023, Gazans had access to around 80 liters of water per day. Since then, however, Gazans only have had around 2 to 3 liters per person each day. Even then, much of this water is not consumable without being purified. I'd also like to add that the recent political events in the region has also forced Gaza to close all 5 of its wastewater treatment plants, leaving whatever water they do have unpurifiable. As a result, this leaves many Gazans to resort to consuming contaminated water, therefore experiencing symptoms of stomach pain, nausea, fever, vomiting, diarrhea, among others. I included this graph to help you visualize the effects. The World Health Organization suggests that any person in any given country has access to around 100 liters of water per day. Gaza before the war had around 88 liters of water per day, and Gaza today has only around 3 liters of water per person per day. As you can see, people in Gaza lost around 90%, 97% of their average daily water consumption that they need for hydration, cooking, and hygiene, and other basic needs. The last issue I want to talk about is access to healthcare. A report by the World Health Organization in June 2024 reported that only 12 of Gaza's 36 hospitals are currently functioning, although a majority of those have suffered damage amid the recent events. Even then, these remaining hospitals face a major shortage in medicine and disposable supplies that they need to provide care for patients. This includes shortages in anesthesia, IV, and insulin, among many other life-saving drugs. In addition, 350,000 of Gaza's 600,000 population face some sort of chronic conditions, such as diabetes and cancer, that will now go untreated because of the lack of proper resources. There's also an estimated of 50,000 pregnant women in Gaza, which are also now subjected to miscarriages due to the lack of care. I also wanted to add that the female population currently suffers from widespread lack of menstrual and hygiene products, which is known to cause a painful and chemical imbalance in their body. Nearing conclusion, I would like to let you know what you can do. An article posted by the Johns Hopkins Bloomberg School of Public Health suggested to stay up to date, only reading trusted and nuanced viewpoints about the crisis to help combat misinformation. They also suggest to advocate for all civilians in the region to not be used as pawns in this or any conflict. And finally, they encourage individuals to contact their elected officials whom they are constituents with and ensure that humanitarian principles are respected by all parties in this conflict. So here's what you need to know. The health crisis in Gaza is an emergency severely impacting many different issues, including mental health, water access, and healthcare services. It is important that we address these issues with informed advocacy, reliable information, and a commitment to the humanitarian principles that will ensure the well-being of all civilians affected by this ongoing conflict. Here are the references I used throughout this presentation. I'd also like to provide some acknowledgements. Thank you to my sister Haya Kidwai and my best friend Olivia Fan for providing genuine and constructive feedback. I'd also like to say thank you to the Global Health Leaders Conference at Johns Hopkins University for this opportunity. Here's my information if you would like to reach out with any questions or to connect. And with that, I would like to say thank you for your time and for listening, and have a great day.